Hey, what's up, guys? This is Mr. Suited, and I'm definitely going to stress the fact that the dental hygiene board exam is no joke. I actually know people that did not pass the dental hygiene board exam after taking it multiple times. So I take this seriously. I want to give you guys some information and help you guys study so you can pass your dental hygiene board exam. So today I'm going to give you my 4th case study that helped me create and study so I can pass the dental hygiene board exam. The case study goes like this. Jessica Robinson is a 48-year-old female that's coming in for a deep cleaning. Her chief complaint is that she's suffering from a lot of headaches. She has an allergy to latex, and on her health histories, it shows that she has vertigo and she has high blood pressure. The first thing I'm going to consider is Jessica's latex allergy. I want to make sure I stay away from any latex material. Using nitrile gloves is preferred. Most likely, I'm going to make sure that our office protocol is put in place, and if we have an EpiPen at hand, that'll be perfect. We want to make sure that we're ready for any type of anaphylactic episode. The second thing that I'm going to consider is Jessica's vertigo. I don't want to lean her chair back too quickly because I don't want to initiate any type of nausea or dizziness. The third thing I'm going to consider is her blood pressure. I want to check her blood pressure and make sure it's controlled. If it's too high, if her systolic is over 160 and her diastolic is over 100, most likely I'm going to end up postponing their appointment. But I'm going to make sure I take my time. I want to make sure she's relaxed. Maybe turn off the light, maybe talk about some breathing exercises to help her relax. And then I'm going to retake her blood pressure. If it's still 160 over 100, most likely I'm going to postpone her appointment. So with the risk of high blood pressure, Jessica could have a stroke. She could have a heart attack. She could have increased bleeding during the deep cleaning. So we definitely want to make sure that her blood pressure is controlled. So because we are doing a deep cleaning, we don't want to use any type of vasoconstrictor. Stay away from any type of epi. No lidocaine, no septicaine. Keep it mepivacaine. Want to make sure that we're not sending a spike to her blood pressure. So the next thing that we're going to consider is, why does Jessica have a lot of headaches? It may be the fact that she has some bruxism going on. We want to check for wear patterns, look for a little bit of attrition. If her molars are flat or if her front anteriors are getting a little bit smaller, it could be that she needs a night guard at night. So we want to talk about stresses. Is she stressed out? Maybe she needs some breathing exercises, maybe offer some yoga for her to consider. Also, when we're talking to the doctor, we want to let him know so he can see if her airway is in place, because sleep apnea and bruxism are definitely related. See how the information is like a puzzle piece? We want to make sure everything fits. Yes, the systolic and diastolic is a good term, but how does it correlate to the whole case study? This is how you're going to pass your dental hygiene board exam. And let me say this, if you guys are really interested in these case studies and you like how these are formed, you guys should get this planner here on Amazon. It's going to help you track your patients and create case studies. You can write down what their medical history is. You can write down certain things to consider, and then you take this information and create your case studies. If you do this, you will pass the dental hygiene board exam. Let me know if it helped. And if you guys want, let me know. I can create more for you guys. Thank you guys.